Brings you in today? How's it been?
Good to see you, Dr. Lovely. Actually, I've been coming in, I've been experiencing some stomach pain, and I've been really tired lately.
Really? Well, let me check your records real quick. We'll see how this goes. These should not be taken lightly. Have you also experienced any weight loss or vomiting?
I actually have. I had the stomach bug earlier, and I experienced some weight loss from that, but the intense stomach pain continued, and I continued to lose weight, so I came to you.
I see. It appears your skin has a yellowish tint to it.
I thought that was just the kind of pill you got when you get sick.
You know, with your history of alcoholism, we're going to have to perform some tests as you're exhibiting some symptoms of some very severe diseases. The abdomen pain, jaundice, and fatigue are what I'm most worried about.
Are you sure? What kind of diseases?
You know, I think we need to test you for hepatitis A, B, and C, and also liver cancer. I mean, don't freak out about this or anything. It's just routine tests.
Good. Sounds good, Doc. Test for these diseases.
Well, first I have a few questions. I'd like to ask, how long have you been sober? And also, how long were you an alcoholic?
I've been 2 years sober. I became an alcoholic 12 years ago when I lost my job, and to be honest with you, I don't have insurance, so because it's been kind of tough getting a job since I was an alcoholic for so long.
Have you ever been vaccinated for hepatitis A and or B?
Yes, I have.
Good, then we can roll those out. You ever injected drugs or did you receive a blood transfusion prior to 1992?
I injected drugs during my years as a heavy alcoholic, and I did have a blood transfusion when I got into a car crash actually in college in 1990, so yes, I've had a blood transfusion before 1992.
Hello, this is Luke. Oh, you have my blood test results? Well, that's good. And the HCV antibody was negative? Oh, great. Oh, my test showed liver function abnormalities. What do I need to do now?
Well, because of the abnormalities that include abnormal AST, ALT, bilirubin, alkaline phosphate levels, I am going to have to recommend that you get an ultrasound of your liver to check for any masses or gallstones causing these problems.
Okay, so today we're gonna do an ultrasound of your liver. Basically what it does is produce pictures of inside of the body, in this case the liver, using sound waves. It'll involve the use of small transducer and an ultrasound gel, and it'll be placed directly on your skin. High frequency sound waves are then transmitted from the probe through the gel into your body. The transducer collects the sounds that bounce back, and a computer then uses the sound waves to create an image.
Got it. Let's do it.
Okay, we're going to rub this on your upper right abdomen to get a good look at your liver.
So Luke, I'm really sorry to give you this bad news, but the ultrasound shows that you have a 5 centimeter mass on your liver and no gallstones. I'm going to order a liver biopsy to see if this is cancerous or not and test to see if your AFP levels are elevated, which is a tumor marker for the liver.
Okay, I guess I'll just try to remain calm until the biopsy.
Happen today. You lie on your back with your right elbow out to the side and your right hand under your head. It's important that you remain as still as possible during this procedure. First, I'm going to give you a small dose of a sedative just prior to the procedure. Next, I will clean and numb an area on your upper abdomen with a local anesthetic. Finally, I will then make a small incision on your upper abdomen and insert a needle into this incision to take a small sample of liver tissue for analysis. I will then send the biopsy to a pathologist to read.
So, Mr. Smith, it seems that you have had 2 procedures done here at Park West by an interventional radiologist, an ultrasound and a liver biopsy.
Yes, but I don't have insurance to cover it.
Well, these procedures are expensive. It's okay. We can put you on a payment plan. This way, you pay back money to the hospital in increments for the next year. It will be $189 a month, though.
That sounds good.
So Luke, I'm really sorry to be the bearer of bad news once again, but the pathologist report says that your liver biopsy was poorly differentiated lesions consisting of large multinucleated anaplastic tumor giant cells with central necrosis. This means that you have liver cancer. I'm going to have to refer you to an oncologist.
Do you have any recommendations for a counselor?
Yes, I'll give you the name of one of the best grief counselors I know.
Thank you.
Hello, Luke. I'm Dr. Newman. I'm sorry we're being under these circumstances, but I'm committed to giving you the best care possible.
Thank you.
So, Luke, basically there are 4 options to treat liver cancer. The first would be surgery. However, you are not a candidate because the mass is too big, your history as an alcoholic, and therefore it is too close to the vessels, like the hepatic artery, to do surgery. The next option would be a liver transplant, but you are not a candidate because the size of the mass and again the proximity to the hepatic artery. Another option would be radiofrequency ablation, but again, you are not a candidate because of the size, being 5 centimeters. Finally, that leaves us with chemotherapy. Chemotherapy to the liver is not very effective, but it is the only option for you. Chemo can be curative or palliative to decrease the tumor in size to help with symptoms. In your case, the chemotherapy should be curative. Even though you do not have evidence of metastasis, the size of the mass worries me. It can be given in 2 ways. The first way, transarterial chemoembolization, which means to inject chemotherapy directly into the liver using the hepatic artery, but you have clinically deteriorated too much for that due to your alcoholism. Your only choice is systemic chemotherapy with the drug sorafenib.
This sounds really complicated. It's going to affect my everyday life.
Not much. Sorafenib is a tablet that should be taken in 400 milligram doses twice a day. Normally, it is given indefinitely unless the patient doesn't tolerate.
Okay, that sounds manageable. The only problem is I don't have insurance. Will I be able to afford this medication?
Well, it will be a challenge, but you can do it. I would recommend calling the company that sells sorafenib, NATCO, to talk to them about their compassionate use program.
That sounds good. Thank you. Hi, my name is Luke Smith. I was recently diagnosed with liver cancer and do not have the insurance to cover the sorafenib, the medicine my oncologist prescribed that you guys sell to treat it.
Yes, we have a program called Compassionate Use that we have for patients that cannot afford and or do not have insurance but need life-sustaining medicines. With this program, we give extra medicine we get from the manufacturers to patients that cannot afford these medicines. We should be able to provide you with sorafenib due to liver cancer's deadly nature.
So, Luke, how have the last few weeks been for you?
They've been pretty rough, just trying to learn how to cope with what's happened.
Has your family been helping you through this process?
Well, my mom and my dad have actually been helping me after I broke the news to them, but I haven't broke it to my wife and kids after we got divorced. It's been kind of tough, and the kids haven't seen much of me, and I don't want this to kind of affect their lives negatively.
Well, I see where you're coming from, but you really should break the news to them as soon as possible. You know, they're part of this too, whether they like it or not. And I mean, they will be here, believe it or not, to support you. And that's another pillar you can lean on for support.
Absolutely.
All right, Luke. Well, I have some advice for you, just friendly advice, trying to help you through this. So, you know, if you really want to find some outlets for your grief, you know, you could find a healthy form of exercise to do. You could maybe find a new hobby. Have you explored finding a
Started
new hobby?
playing chess actually with my brother and things, and we've been playing a lot. And the exercise isn't really an option right now because the chemo kind of drains me, and just trying to find something where I can use my mind and have an interesting time and stuff, but not being able to like go outside and exercise too much because of the chemo.
Yeah, that's perfect. So, how did you feel when you first got the diagnosis that you had cancer?
I was pretty shocked when the doctor told me, but I didn't really know what to say or how to act, and I've trying to keep a normal routine and stuff like that, but it's been kind of tough. Ever since it happened, you don't really know how to handle it, but coming to you's kind of helped.
Yeah. Well, Luke, you're doing a really good job, and keeping a normal routine is perfect. That's exactly what you need to keep doing. But I have another more serious question. Have you turned back to alcohol since you got this diagnosis?
No, I didn't think it would actually help my I mean, I wanted to, but after being an alcoholic for a few years, but I stayed away from it, and I didn't think it would really help my progression with the disease.
All right, that's very good, because that's the last thing you want to do, especially with having liver cancer. That's not a good thing to do. Well, Luke, I think this has been a really good session. Thank you for coming in. If you need anything, just give me a call. We could probably do this same time next week.
Yeah, that
Is that
sounds
good for you? All right. Hey, if you need any other like extra support, you know, your parish is probably always there for you. You know, so just talk to your priest.
Ain't been
and
there in a
stuff.
while, so.